Hi, and welcome to the UA Clicks at the University of Arizona for the College of Public Health. This is a picture of our public health building, and I'm going to be talking to you a little bit about myself and about email communication and also about public health in your first year. First, we'd like to start all of our presentations off with the land grant acknowledgement statement. The University of Arizona sits on the original homelands of indigenous peoples who have stewarded this land since time immemorial. Aligning with the university's core value of a diverse and inclusive community, it is an institutional responsibility to recognize and acknowledge the people, culture, and history that make up the Wildcat community. At the institutional level, it is important to be proactive in broadening awareness throughout campus to ensure our students feel represented and valued. My name is Melanie, and I am the coordinator for the undergraduate programs at the College of Public Health. I'm going to be delivering this first component of UA Clicks. That middle picture is my family this summer. It's been an interesting summer, I'm sure, for all of you as well, and we so wish we could see you in person. But this is a picture from 4th of July when we were able to go to campus and celebrate and be outside. So what is public health? You probably have heard this a few times through your orientation sessions and meeting with your advisor, and maybe you've looked at our website, but public health really finds a way to weave social science with natural science. What we mean by that is that it looks at the factors of human behavior, including economic factors, and disparities as they relate to health and wellness, and also overlays that with the biological science, including pathophysiology, microbiology, statistics, and epidemiology. So as opposed to an individual level care, public health is really interested in community level prevention and looking at the person and the community holistically. So that's what you'll find when you study public health at the University of Arizona. Some important things that we want to make sure we cover for you as new students at the university is to talk about communication. And there are a few different things that are very important for that. The first and most important thing is our university email system is called Cat Mail for students. We are going to recommend that you check it at least once a day. Multiple times a day would be even better. Also, we're going to recommend that you always check your spam folder and your junk folder. You might potentially miss important emails from your instructor or from your advisor. So that's going to be a really important key to your success, is to check your email and to also check those folders in case you might miss something. You are going to receive emails from our college advising team. You're going to see them typically from me, from Melanie. You're going to be added to our pre-public health listserv, and so we always recommend reading those. We try to limit the number we send you so you're not overwhelmed, but there's going to be important advising updates, course updates, registration updates, and just things that we think that are really important for you to know. So pay attention to those when you receive them. Every Friday, we send a digest email to our public health students. And that includes campus announcements, course announcements, volunteer opportunities, internship opportunities, campus resources, including tutoring. So you're only going to receive that once a week. So we do recommend scrolling through that every Friday. And again, mentioning your junk mail. So we're going to recommend that you add your instructors, your advisors, the college, your teaching assistants, anyone who you might interact with. We're going to recommend adding them to your address books just so that those messages aren't filtered to junk. Email is going to be a really important way that you communicate with folks on campus. And we have some general guidelines that we would love for you to be aware of, and that would really help us when serving you and when you're working with your instructors. So we're always going to recommend using your university email address when communicating with instructors rather than your personal Gmail or other email format. That your university email address shows that it is coming from someone within the university. We're always going to recommend that you use your full name and your student ID number. That's that number that starts with a 2. That really helps us as advisors and your instructors look you up and kind of remember, which student you are, because some students maybe have some common last names or common first names. We're always going to recommend that you be formal and courteous. And so what we mean by that is include a subject line that is relevant to what the content of the email is going to be about. Include a salutation, a dear, or addressing if your instructor is a doctor, has their PhD or MD, making sure you have that salutation in there. And we're also going to recommend that you sign it with your full name. And that way we just know who's reaching out. In terms of being courteous, we would love for you to think about how does communicating respectfully ultimately get you what you're asking for or what you need. And, you know, that might be a lot of different things, including communicating about deadlines or about assignments. But, you know, having that courteous tone will make a huge difference in how you receive a response. Another recommendation we have is thinking about a cooling off period. So sometimes students will, in our advising office, they'll send us emails perhaps in the middle of the night while they're thinking about something, or they have a really burning question. And then, you know, it's not complete. And so we're gonna recommend that you take your time to compose your email and kind of think about what's the question that you're asking, and ask how we can help, because that's what we're here for. And same with your instructors. So email is going to be important. And again, making sure you have that subject line, the salutation, including your full name, all of those things will help you get a response faster. So what I want to talk about now is public health in your first year. So you are public health students, which means you care about people and you want to help people and you care about health and wellness. So I'm going to be talking about alcohol, sexual assault, and mental health. There are no stories, there are no images, but please, you know, if this is triggering for you in any way, feel free to tune out, and, you know, or fast forward until until you feel comfortable. But that being said, we do know that there is some important information that will protect not only your health, but the rest of the student body's health, especially in your first year. So really helping others, this is public health. You know, public health students, something that you all have in common is you want to help people. And we're going to go through some concrete ways to do that and some things to look out for. So when it comes to alcohol, you know, there's this expectation that the University of Arizona or other, you know, large schools in the country, that everyone is choosing to use alcohol, and they're perhaps doing that irresponsibly. Based on the 2018 Health and Wellness Survey that's done by our campus health service right here at the university, where they survey current students about their alcohol drinking habits, 39% of UA students report not using alcohol in the past 30 days. So that means, you know, over 1/3 of students are choosing not to use alcohol. So often I hear from students, you know, I'm the only person who doesn't drink. I am the only person who chooses not to do that. When the reality is almost more than 1 in 3 students are choosing not to use alcohol at the university. So you're not alone, and the university can and does support students who choose not to use alcohol. You know, it's almost half and half, right? So we know that those students are here, and that the University of Arizona can be a place that supports students who choose not to use alcohol. And among students who do drink, we think this is really valuable too. Most students are drinking responsibly. So the survey showed that 50% of students set a limit on how many drinks they will have before they choose to have alcohol. And 57% of students alternate with non-alcoholic beverages. So again, thinking about that harm reduction, that if you do choose to drink, what can you do to be safe? And we know that over half of our students are practicing some of these really practical harm reduction and risk reduction strategies. So often what we'll hear from students is they want to know, what if it's an emergency? What should I do if I'm really worried about my roommate or my friend or my fraternity brother or my sorority sister or my teammate? And so this is something that is kind of thinking about that worst case scenario, but also knowing how you can help and what to look out for. And so a helpful acronym is CUPS, and the C stands for cold skin, if the person is cold and clammy. If the person has been drinking and they are unresponsive, and they aren't reacting to any kind of stimulus or you know, a way for you to wake them up. P is for puking. If you notice that they are vomiting and perhaps unresponsive, or they're vomiting and they're not able to shift positions, that is an emergency, and that's the right time to call for help. And the S stands for shallow breathing. So if you notice the person is breathing at an irregular rate, all of these indicate a serious alcohol emergency, and that's the time, and it's the right time for you to intervene. The University of Arizona does have a medical amnesty policy for students who are on campus. So if you choose to call the university police department for someone who you think is suffering from alcohol poisoning or has some of these symptoms, and you're worried about them, the policy is that the person who makes the call will not be cited as long as they stay on the scene and are compliant and help with the emergency at hand. So what we want to say is, Don't be discouraged, but for calling for help, you are the right person to do it. And as soon as you're concerned, as soon as you have that thought, I wonder if I should call for help, that's the right time to do it. We also want to talk about sexual assault. So sexual assault is more prevalent on college campuses compared to other crimes. That's not to say that it's super common and that everyone is at risk of being sexually assaulted, because we know that's not true, but we do know that it is a preventable thing. And there are opportunities for friends to look out for each other. So as a member of the UA community, you are able to make a difference by helping others. And I'll give you some tips here. What to do if you or someone you know has been sexually assaulted. The first thing is you can call 911 for emergency medical care or immediate danger. And the second thing we recommend here is the University of Arizona has a survivor advocacy program that has confidential reporting options as well as support available for students. But overlay all of this, if you have a friend who is reporting or has told you that they've been sexually assaulted, the number one thing you can do is believe them. No one causes their victimization, and no one chooses to be sexually assaulted. So if they're sharing that information with you, that means you're a safe person. That means that you have the power to help and to refer them in the right place. And so know that is an important role that our students will play, and that you are the right person to be there for that roommate or that friend when they disclose something as worrying as sexual assault. And do know that once a student does report, there are resources on campus for help, and there are people who will help that student. The last thing I want to talk about when we talk about public health in your first year is mental health. So according to the 2018 Campus Health Survey, again, that surveyed actual current University of Arizona students, almost half of students reported feeling overwhelmed by all they had to do in the past 30 days. So you probably are in that category. I think I'm in that category that, almost half of students are reporting feeling overwhelmed, and that's normal, right? So we know college is busy. We know that classes will be busy, that you'll have demands on your time. But we also want you to know what to do when you're feeling those feelings of overwhelmed or hopelessness or stress. We also want to say that students do seek help at our counseling and psych services at the University of Arizona, and more than a third of those students have reported, based on the survey, that it helped them remain a student at the UA. So know that there are resources available, and that these ultimately will help you stay at the university and get the support that you need. So never be afraid to use the counseling service, and they are professionals that specialize in college student mental health. So I think that's a really important resource that you have available to you, either when you're on campus or accessing them virtually as a student at the university. This is a resource that we refer students to all the time. So if you're worried about yourself or a friend, here are some very simple things to look out for that we think can indicate it's an opportunity to reach out for help, for professional help. So if you're feeling overwhelmed, or if a friend is reporting feeling very blah, if you're noticing that someone is crying or you're finding yourself crying, if you're experiencing loss of motivation, if you're noticing that a friend is having changes in sleep, eating, or school habits, that's an opportunity to reach out for help. And then also changes in reliability. So if you have a friend who is always present for your virtual discussion, or you're meeting up for dinner outside or something like that, and all of a sudden they stop being present, that's an opportunity, I think, to reach out and offer help. So that was a very brief overview of some of the main things that we like to talk to students about and that we see in our advising office all the time. And we just want to share some important resources. So you can feel free to take a screenshot pause me and take a screenshot of this if you'd like. We will also have some links to this. There are links to this on our website. You can also, Google University of Arizona CAPS, and you'll find the information that you need, the phone number and website there. But we want to share that CAPS is available for counseling and crisis help, and their phone number is 520-621-3334, and it is available after hours. So if you call after business hours, there will be a professional that answers the phone. Your RA, your resident assistant, is going to be a huge help for you if you're choosing to live on campus in your first year. The University of Arizona has a dedicated police department, so 911 will reach them. That's an important, especially if it's an emergency or a crisis. And then also in Pima County, we have a mental health crisis response center that's available 24 hours a day, 7 days a week. And their phone number is 520-622-6000. So this is just a sampling of some of the resources that you have available to you and that the university has in place to give you that wraparound care and to make sure, we know that you're a student at the university and we know that you're attending classes, but also we want to keep you healthy and whole. For sexual assault, there are a few resources. There are 2 on campus. So Counseling and Psych Services, our CAPS office, also works with students who have been impacted by sexual assault, relationship violence, and stalking. So again, that phone number is 520-621-3334. And there's lots of information on their website. And then the University of Arizona Survivor Advocacy Program has advocates who are available for students who have experienced any of these things related to sexual assault, that they can reach out to instructors, they can work with you to find care, to find mental health care. So there's just lots of opportunity there for help. And then off campus in the Tucson community, we have the Southern Arizona Center Against Sexual Assault, and their phone number is 520-327-7273. And they're also available 24 hours a day. Also, when students are in a crisis or an emergency, we find that they often ask themselves, well, what can I do? How can I help? And we want you to know that there are some really important ways that you can make a difference when someone is experiencing perhaps an emergency. So you can be direct if you feel comfortable. So asking the person if they're okay, that is absolutely an acceptable way to check in on someone, and we know how important that can be when we aren't feeling okay and when someone asks and shows that they care. If it is an emergency, there's opportunities to distract the person while maybe you either call a police or remove the person from the situation. So an example here is your car is being towed, or another kind of another opportunity for distraction can be used, and we encourage you to be creative, especially if you're worried about someone and you need to kind of separate them from the situation. And then delegate. If you don't feel comfortable making that call or intervening directly or doing that distraction, you can also always call your RA or 911. We want you to know that you're not alone in feeling, and you will not be alone in experiencing tough situations, both inside and outside of the classroom. And we also want you to know that you are the right person to step up and make a difference when you notice something someone or notice something that needs your help. So why is this important? Why did we dedicate just these last handful of slides to talking about these topics? Because, our vision, especially in the College of Public Health, is we want to keep you happy, we want to keep you healthy, and we want to get you to graduation, because we know that's the ultimate goal, is to graduate and walk across that stage with your friends and family cheering you on. We know that in reality, it doesn't always go that smoothly, right? So, starting the semester, you might be really happy and really excited, of your first year at the university. And then, you might be feeling healthy, and then something might happen where, maybe your mental health, it takes a dip, or, you experience some kind of the flu, or, we're talking a lot about COVID-19, which is going to be a reality, in students' mental health and overall physical health this semester. So, we know that happiness and health kind of, are important, but we know they can come and go. And there are times where you're going to feel exceptionally happy, and there are going to be times when you feel very healthy and times when you feel kind of on the other side of that. So the reality is that, you will graduate, and we will be there to cheer you on as you do so. We're also there to help support you when you are feeling unhappy or unhealthy, and thinking about, how can we help you, and how can you help yourself to feel better, and how can you help your friends who might be kind of going back and forth from that. Because again, our ultimate goal is to get you to graduation, and we're confident that, we can do that. And that we are here to help, and that the University of Arizona has many resources for you to seek help as well. So that was a fast overview. A couple things, we just want you to know that your advisor is here for you, and our office is busy, but we are always here to serve students, and we prioritize students, especially if they're having trouble or feeling in crisis. So please keep that in mind. We're also going to recommend that you continue on to the next module, because this UA Clicks session will have lots more information, and you'll have a chance to hear from our other advisors and also from our student ambassadors, who can talk a little bit more about what does that happiness and what does that health look like, and how has it supported them in their goal to graduation.